What Health 2020 identified were priority areas. We're not going to solve those problems. These problems aren't going to go away. But I think what was really innovative in Health 2020 is that it shifted the agenda, or it encouraged governments to look at a new agenda that was really quite challenging for them in terms of shifting the direction of healthcare delivery. So really, as we've said, to shift the focus from hospital-based care, acute care and treating disease, to move into health promotion, prevention of disease and managing long-term conditions. And that needs a really significant shift in how budgets are managed and where resources are targeted to. So that I think that shift is happening in some countries, not so much in others. And it's very difficult for some aspects of the world to even begin to tackle these things. So by 2020 we are not going to have solved long-term conditions, but we won't have solved communicable diseases like AIDS, Ebola, but we will have identified that policies need to change, and there will be new policies in place where the priority is on those conditions. And obviously we still need to deal with acute care and people having heart attacks and all of the surgical interventions, but if the focus is on prevention and supporting people to self-manage, so again that's a significant shift, really putting responsibility on people themselves to take better care of themselves, so that there's reductions in healthcare demand. So by 2020 we won't have achieved that, but in the period of time up to 2020 there should be a shift in government policy that's moving in that direction. So it's more of a directional change rather than we'll be able to tick that off as achieved. Similarly, the Millennium Development Goals weren't all achieved, but there was significant shift in many areas, particularly things like maternal child health. They weren't all achieved, but we've moved in the right direction. So these are goals really, rather than something that's likely to be able to be ticked off as well. That's done. I think these problems are complex and significant, and they'll be with us for a long time, but we're moving in a different direction. From a UK perspective, there's been a really significant shift in terms of we now are working towards integrated health and social care. So our recognition, as we were talking earlier about shifting demographic, people are living older, the policy drive, if you like, certainly within Scotland, is that people should live long, healthy, happy lives in their own home or in a homely environment, so that we're not admitting elderly people into big, huge hospitals, but we're developing packages of care that integrate nursing care and social care, so that people are supported to live in their own communities, in their own homes. So that's a significant policy change, and also a practice change where nurses are now having to work much more closely with social workers. They always have done, but that role is changing. Healthcare teams, we now have teams of health and social care practitioners working primarily on community bases. So I would say over the last 10 years there's been a significant shift in the UK. I'm not sure about other countries. Obviously funding is different in other European countries as well, so that the funding mechanisms influence what healthcare's provided, and obviously systems that are insurance based have different priorities than those that are state funded. But I think there's been significant shift in terms of what's identified as a priority. Healthcare, both in terms of nurses' working lives and what the role of nurses, what nurses are able to achieve, and also what governments choose to fund and prioritise. These are fundamentally political and contextual discussions and decisions. So I think what things like the Sustainable Development Goals, these are global. So all of the member states of the United Nations have signed up to these. So it's governmental, so it's shared political will to agree that these things are important and we will move towards them. But whether or not they're achieved, or the pace at which particular governments move towards them, I think is debatable. And whether some of them will be ticked off. Extreme poverty, I live in the UK, there's children living in poverty in the UK, and you can just say that is immoral and should not happen. But they're looking in terms of how do you deal with this really, really complex social problems, and how do you find a political solution to that? And I think in terms of bringing healthcare into that complex social and political mix, I think what nurses can do is try and influence policy, try and implement policy, and also as practitioners we can try and do the best that we can for the individual that we're working with at that point in time. So it's a very, very complex, messy problem, things like poverty, but they're so intertwined with health. If you're never going to have good health if people are still living in poverty. At a macro level, health is definitely influenced by political systems that people work within. But again, I would say, as looking at what nurses can do, nurses have to enable the individual that they're working with to make individual and personal choices that will maximise their health. So even people who are working in very constrained and difficult, who are living in very difficult and constrained situations, can be supported and enabled if they have access. So it's that universal coverage, the access to healthcare that can help them live the best life that they can. So there's macro levels within political systems, and there's individual levels, what we as practitioners can do with the individual that we are interfacing with. And I think we need to work at both those levels.